Yes, the sounds of the Bayside, and this is Best Medicine with me, Gaetana. And on the line, I have Dr. Helen, Melbourne dentist. Good morning and welcome to the program, Dr. Helen.
Good morning, Gaetana.
Well, it's lovely to speak with you, and you have got some very important information to share with us today, haven't you? Just reminding people about the importance of maintaining good dental hygiene in isolation. Now, let's talk about why it is so important to keep up our oral care routines.
It is indeed very important. What happens with oral hygiene, and I guess before I focus on oral hygiene, I would like to give the listeners a bit of a background to what I'm about to say. It's very important to understand that just because we have many doctors, cardiologists, oncologists, endocrinologists, dentists, it doesn't mean that different parts of the body function independently.
Yes.
The whole body functions in unison, and oral health is linked with overall health. And to give you an example, oral health has very strong correlation with coronary heart disease and diabetes. So, as far as this virus is concerned, we know that the demographic of people who are most susceptible to it and the ones who are least likely to recover are people over the age of 65 with at least one chronic condition such as coronary heart disease, diabetes, hypertension, and this is where oral health is very important.
Yes, can I interrupt for a second? I was going to point to this because I've been keeping an eye on the articles that are available to the public, over the last few years, because really the microbiome in the mouth, there are some goodies, but there are also some baddies, aren't there?
There are, and what we know is that people who have poor oral health also have poor heart health. According to the American Heart Journal, a male with periodontitis, which is gum disease, is 70% more likely to develop coronary heart disease from bacteria in the mouth that's responsible for periodontitis is the same bacteria that's responsible for heart disease.
Interesting. It is fascinating.
Very, very important. Yes.
And I think
it's very important to brush and floss daily.
See, this is it. Let's talk about that then. So you're saying brush, floss, or presumably use interdentals. Give us the routine for adults and children and how often we should be doing this.
Okay. So contrary to common advice that you need to brush your teeth twice a day, I usually recommend to my patients to brush and floss once a day. But that means that you have to floss as well. A lot of people brush twice a day, but they don't floss. And we haven't been taught how to floss, and we actually haven't been taught how to brush correctly. There are lots of resources online. I suggest to look it up, the correct brushing technique. It's very important to remove plaque from around the neck of the tooth, just at the junction between the tooth and the gum, because that's where plaque harbors, that's where it causes gum disease and creates little wounds in the gums for bacteria to enter into the system.
And when you're saying brushing, you're not, I'm assuming you're saying brush gently, not push hard, because that can affect the tooth enamel and things, can't it?
Absolutely. You got it right. Soft toothbrush, gentle back and forth strokes, concentrating on each tooth at a time. As a guide, I usually tell my patients 3 seconds on each tooth, the outer and the inner surfaces. But and no pressure, because you're quite right, you'll be scraping precious tooth enamel off your teeth.
And the other thing I want to ask about too, are dentists, are you still recommending that when people have had, say, some acidic foods, fruits or something, that they don't immediately brush because the acid or acidic drinks too, that may have softened the enamel? So are we supposed to wait a little while? Is that right?
Oh, you're very well informed. That is indeed correct, and a lot of people don't know that. what happens if you have an acidic food, whether it's fresh fruit, which is perfectly healthy for you.
Yes, and we need it, don't we?
We need it indeed, but it is acidic. And what will happen, it will demineralize enamel, so it will take minerals, calcium and phosphate, out of the enamel. But saliva is a natural buffer, and it will naturally remineralize over the course of about 20 to 30 minutes. So this process will reverse itself unless you brush in that window of 20 to 30 minutes, in which case you'll actually be scraping some weakened enamel off.
Right. Now, tell me if I'm right or wrong in doing this, Dr. Helen, but what I tend to do is I tend, after I've eaten each meal and if I have a snack in the afternoon and after I've had fruit and things, I don't have fruit juices, I don't have acidic drinks or colas or anything like that. But after I've had it, even after I've had, say, a cup of tea or a drink of coffee, I tend to take a little bit of slightly warm water and rinse my mouth a few times out and rinse the teeth thoroughly. Is that a good idea or not?
Well, it's not a bad idea. It's quite intuitive, isn't it? If you have something acidic, you would want to dilute it a little bit with water, and it makes perfect sense to do that. But interestingly enough, there isn't adequate research to support that idea. But that doesn't necessarily mean that it doesn't apply. It's not a bad thing, and you're not doing any harm by doing that, and it does make sense to do it, but I wouldn't necessarily do it obsessively, because if you don't do that, the teeth will just remineralize naturally.
Good. Nice.
So it's not
to
a
know.
must.
No. I think I tend to do it because my teeth are pretty close together, and I like to just, especially after a meal or having a biscuit or something like that might be sticky on the teeth, I tend to like to sort of give a little rinse before I actually gently brush, because I'm trying to loosen things up a little bit, you know.
By all means, if it makes you feel more comfortable, there is absolutely no harm in doing that.
Now, what's your advice for, as I say, people like myself with a lot of teeth that are very close together? I find it hard getting the floss in and getting it out again. Sometimes I'll use interdentals and pick things instead to gently go through. What's your advice?
Interdental, you mean little interdental brushes?
Yeah, little brushes,
okay. So toothpicks are not particularly useful.
No.
Toothpicks are good at dislodging food, but little interdental brushes, they're like little bottle brushes.
Yeah.
They are excellent.
Oh,
but
good.
They only work for people with reasonable gaps between their teeth. If there are no gaps and you can't get those in, then floss is still my advice.
Okay. And what's the advice too for the children? Because we need to keep the children, don't we?
Yeah.
Doing the right things for themselves and maintaining the habits, don't we?
Yes, and it's good to teach them the good habits from an early age. And the reason why a lot of us don't know how to floss and brush, and in fact a lot of my patients don't, is because they haven't been taught from a young age. Advice for children is much the same as for adults. Brush once a day, brush well, make it fun with them so it's not a chore.
Yep.
Teach them to floss, and they might not be very coordinated at that stage, but if they see you do it, the best way to teach a child is to give them a good example. Do it yourself, do it with them, make it fun, and they will learn that is just something that needs to be done.
Yep. That's a good point to make. And I gather from a few little things that I have read on your website, etc., you are a keen plant-based eater, aren't you?
Oh, absolutely. I can't stress enough, once again, if I go back to what I said before, oral health is linked with overall health. And studies tell us that people who eat a lot of fruits, vegetables, have stronger immune systems. So they're more resilient to infectious diseases and they're more likely to recover quickly. But the evidence linking diet, a healthy evidence linking saturated fats, which come from animal sources such as meat and dairy, and coronary heart disease, diabetes, certain forms of cancer, autoimmune diseases, is indisputable. And whether we like it or not, this is what the evidence tells us. So important to eat well and choose from 4 food groups: fruits, vegetables, legumes and grains. It goes for general health, it goes for oral health.
And also, do we have any evidence to looking at eating a good varied diet like that is largely plant-based, and perhaps throwing in a little bit of fish and olive. I'm big on the olive oil, extra virgin olive oil, and herbs and things, and little bits of perhaps chicken. Does a good, healthy diet have a positive impact on our gums, or is there not evidence?
There is evidence, absolutely. People who eat a diet that's high in fruits and vegetables have lower incidence of oropharyngeal cancer, for instance.
Ah, yes.
Yes.
Oh, that's good to know. Thank you. That's very good to know.
Yes, so they are magic foods for every organ in the body. Also, people who have high saturated fat intake, once again from animal foods, have high incidence of periodontal disease as well. So the same diet of animal fats and proteins that lead to high cholesterol may also contribute to periodontitis, which is gum disease.
Well, isn't it interesting? We're going back to just what you said right at the start of our talk, that really the whole body is interconnected. And sometimes I think we've lost a sense of that, because really the advice, as I said last week to listeners, from the various dietitians I've talked with and whose books I have, and doctors and others, is for the good plant-based diet, etc., whether it's a Mediterranean style or other good ones, that this is so important for all aspects of sort of physical health. It's important for our brains, and now we're learning from you, it's so important for oral health. Everything is so interconnected, and of course also for the gut microbiome too, isn't it? So
absolutely, and the dentists are saying the same things as other professionals are, and I give the same advice to my patients. The number one point to take out of all this diet is the most important thing.
And just the good oral hygiene and doing things regularly, not making a misery of it, but recognising that even though we're in isolation, I was saying this moments ago before we started talking, Dr. Helen, that keeping up those important routines that we would do normally are important in isolation, because they're part of what help us feel connected to our usual way of life, as well as being important for our health, aren't they?
They are indeed. I don't know too many people who love brushing their teeth, but I guess it's a routine that we're used to doing. And yes, it is important to maintain it in isolation as well. But I think the importance of it is just to maintain our health. And when we come out of this and when our lives are back to normal, that we haven't really suffered, or our health hasn't suffered too much.
Absolutely. Now, what's the situation at the moment with people actually, if they need to see a dentist because they've either got toothache or they think, I've got a broken tooth or something else, are dentists still seeing patients? Do they have enough PPE, etc.? Okay,
very good question. For the last 4 weeks, we're only allowed to provide emergency dental care, toothaches, treating abscesses, et cetera. Now, the good news is, as of this week, the Cabinet came out last week and they said that as of this week, we are back to level 2 restrictions. So all dentists are back to level 2 restrictions. This doesn't mean that practice is back to normal as it used to be, but what it means is that we are able to provide more services now. We can do those fillings that had to be done a few months ago. We can do crowns, we can do root canal treatments. What we are trying to avoid, though, is we're trying to avoid treatments that create a lot of aerosol.
Oh, yes.
To minimise the transmission of this virus. So a lot of services can be provided now, but we are still working under restrictions to minimise the spread of COVID-19.
Yes, and I mean, we want patients safe, but we want you dentists and the dental nurses and everyone else safe as well. This is one of those things with working with someone's mouth. You're very close, aren't you? And I know you have the glasses and masks, but really you need more. You need those face guards as well, don't you, really?
So under level 2 restrictions, we still need to wear protective wear, but I guess we are also triaging patients, and we're minimising the chance of somebody who's potentially infected coming into the practice. And we're also seeing one person at a time, so we don't have too many people sitting in the reception area. And protective wear has been an issue for the last few months, as we all know. There are supplies are coming in now, so the situation is easing a little bit. So I believe that dentists do have protective equipment at the moment, but the stocks are still quite low.
Well, look, thank you very, very much. That's been wonderful. All the advice and information has been superb, Dr. Helen. Would you like to just give people your website in case they want to have a look and see a little bit more?
Oh, wonderful. I certainly will. If I could just say one other thing very quickly.
Yes.
I think my advice wouldn't be complete without that. Please stay away from sugary foods. They're not related to gum disease, but they do cause decay or caries of the teeth. So very, very careful, minimise the frequency of those and try to stay away from them.
Yes.
And my website is very easy to remember. It's www.drhelen, that's drhelen.com.au.
Brilliant. Dr. Helen, thank you so much for your time today. Lots of sensible advice and lots of good information. Thank you very, very much.
Thank you very much. Thank you for having me.
All the best to you. Bye-bye.
Thank you. Bye-bye.
Well, wonderful stuff there, listeners. Absolutely wonderful.